The treatment for arrhythmias can vary widely depending on what type of arrhythmia it is. Some we just manage conservatively, monitor the patient. So it's very important to know if you have a serious arrhythmia or one that can be just watched. It's important to be seen by an electrophysiologist to determine which of these types of conditions you have. If the electrophysiologist determines that you may need more invasive treatment, often we start with medications. Usually simple medications like blood pressure pills may be sufficient. If that doesn't work, often a more potent medication like an antiarrhythmic drug may be recommended to a patient. If these do not seem to control the arrhythmia or the patient does not tolerate the medications due to side effects, sometimes we'll proceed with a catheter ablation, which is a more invasive treatment for the arrhythmia, which is often more effective than the medications. For some arrhythmias, we use what's called RF ablation, which is heating of the catheter tip. And this is done in the EP lab. It's done usually after an electrophysiology study, done under twilight anesthesia. It may take a couple hours. It's usually done as an outpatient with overnight observation type procedure. We also have available at Froedtert and the Medical College of Wisconsin cryoablation, which is, instead of using heating energy, uses freezing energy to treat the arrhythmia. This causes a small frostbite burn within the heart, which blocks the electrical signal that may be causing the arrhythmia. And for certain select patients, we may choose this for safety reasons. Often we use what's called three-dimensional mapping, which is where we use a GPS-like device to build up a model of the heart non-invasively to find out exactly where the arrhythmia comes from. This allows for a safer procedure to find out exactly where the arrhythmia comes from and where other structures are to avoid. We do this within the EP lab, and we make a three-dimensional model that we can then visualize the catheters moving throughout.